Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea, 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an Apoquel stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself and to know the directions of how to take it. I've seen her a few times since then and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. I work in veterinary medicine and clients are absolute idiots who are convinced that they are the smartest people in the world. It is amazing that pets actually manage to stay alive. People will believe just about anyone else over the advice of their veterinarian, their breeder, their relatives, their lawnmower, the person bagging their groceries. I had a client blind their cat with tea tree oil because they read about it on the internet. Clients change their pet's medication dose for whatever reason. That's really fun when it is insulin. Not follow post-op instructions causing their pet to eviscerate itself or blow the knee we just repaired. Feed their dog pot roast with garlic and onions as their bland diet for GI upset. Heck, last week I had a client scream at me because we didn't give her an exam room with a view. We don't have exam rooms with outside windows. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation and their eyes were irritated. So they boiled milk, and then poured it in their eye. Burned it all. M's here. Had a diabetic in his 30s to 40s who refused to take insulin since 2012, it was 2020 at the time. When I took his blood sugar is only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ICM I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged, and it took this man less than 50 paces from the door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the and bandaged his entire arm with gauze so that, hopefully, by the time he got it off it would have clotted enough for him to not end up exsanguinating himself. I was using meth for weight loss, have heard a few times actually. This was one of the funniest yet cutest one, was a student doing a shift in andrology, reproductive health. Doc, so you're trying to have kids but not managing to. So do you have any other kid? Patient. Yes doc, I have one. Asterisk doc. Okay, so we need to do this and that asterisk patient. Okay, great. Then he proceeds to visit him and stuff, after which he goes away. After a couple secs he knocked the door again saying, "Hello doc, my wife told me that it would be relevant to you that the son I have is adopted, but that's make no difference to me, I always considered my own son." This happened in med school on my OB/GYN rotation. Patient. Who's the baby gonna look like? Me. What do you mean? Patient. Well, is it gonna look like the dude who got me pregnant or the guy who's been nutting in me the last few months? Me. Utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Vet med here. We get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control. So we often get ones with thyroid, diabetes, heart issues, etc., and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they are still giving the med. Nope, they stopped. It 'cause they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. I used to be a medical oxygen tech, mostly doing in-home work. One guy was on such a high concentration that he would have drawn nearly zero oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on, literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside Out M's fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis," and "I didn't use any drugs." Then I smelled iron in the air and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before. That day nor after. I worked in cancer research surgery a couple years ago. There is a good amount of people who will refuse to have a small removal surgery because they think holistic medicine or praying it away will work. They always come back and we always have to remove so much more. One time a patient had a melanoma on their calf and the doctor wanted to do a simple wide excision, but they left because they wanted to pray it away. Came back a couple months later because it got bigger and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point too. Woman comes in with no prenatal care to labor and delivery in labor. OBGYN resident taking a history. Do you have any allergies? Patient: yes, I'm allergic to water. Resident: okay, what kind of reaction happens when you drink water? Patient: oh, it makes me pee. Yeah lady, that's a feature, not a bug. Thanks for watching. Like and subscribe for more.